Hello, hello. I am Maru Quintero. I work with NC Counts Coalition. I am the bilingual communication and outreach manager. Welcome to Shine a Light, or as we say it in Spanish, Voces que Iluminan. We have created this space to take the time to connect with our members, and you want to meet one of them today, who are part of our communities. We want to hear their stories, learn more about the great work that they do, and see how they connect census to support their efforts in a daily basis. Our guest for today comes from Region 1, which is on the western part of North Carolina. And please introduce yourself, Jéwana, and the organization.
Hi, good morning, everyone, and good afternoon. My name is Jéwana Grier McEach. I'm the Executive Director for ABIPA, which stands for the Asheville Buncombe Institute of Parity Achievement. I love to tell people when I introduce myself and my organization, ABIPA by itself is an elevated speech. So just so people understand, who we are, what we are, and why we are. And so thank you for this opportunity.
Of course, of course. We are so glad to have you. And as I was saying before, we're gonna start with region one, and then we're gonna be moving along the regions. So tell us a little bit more of you before we got into the organization.
It's kind of like one of those 360 moments. I went to school, and this is how we go, through life. We decide what defines us as our career and our career goals. So I went to school at a HBCU, which is a historically Black university. And the name of it is Oakwood University. Shout out to OU. But what really defines and I think explains who I am and what I did before I came to this work really explains where I am at this moment. So when you enter into the campus of Oakwood University, there are gates there. And the first gate says enter to learn. And when you leave out of the gate, it says depart to serve. So I feel like that's really the impetus for what I do. So even though, again, my degree was in communications and business management, who knew I would be in the nonprofit world? And so how I ended up being at ABIPA was that I moved to Asheville from the Piedmont. I grew up in High Point, North Carolina. But I moved here when my girls were in pre-K and first grade because I wanted them to go to a specific school here so they can go through that educational system from kindergarten to 12th grade. And so they did. But at that time, I was here as a single mother, and I was always active in my church, like in our food pantry and things of that sort. And so I decided to start an after school program. It was called Fit for Life. And again, this will go back full 360 about where I am now. So Fit for Life was an after school program where the kids were able to come do their homework. They were able to be healthy by learning how to cook with healthy eating skills and knife skills and things of that sort. Additionally, we focus on physical health. And so we made sure that the kids were active after they got out of school. And then also entrepreneurism. And so for that, for me, that's kind of holistic, right? We're hitting all of the things as we develop our kids. And so the caveat here was in the physical health realm, we got a small grant from ABIPA for the children to learn how to gainfully swim at the YWCA, Western North Carolina. And so I feel like we were really the equity swim before it became popular because ABIPA paid for our children to learn how to swim. And so that grew into a relationship between myself and ABIPA that I ended up coming on as a program coordinator. And then when the former ED left, I became executive director. So if you look at all of these things, it's really interesting just because I came into the work just because of my children. And so, family is really central in much of the work that we do consciously and unconsciously. But I also was just excited to know about the work of ABIPA as I became a part of it.
We never know where lives bring us because you went to the west side of the state for your kids, and then you ended up being the ED from an organization that support your kids to start learning how to swim. The circle
Exactly.
of life, definitely, definitely.
Amazing.
So you didn't found it, ABIPA,
No.
but your heart was there before.
Yes. And so that's the other caveat. So it was actually founded by the late Dr. Charles Blair. In the early 90s, he came to Asheville. Again, he was a transplant, just like me and many others. And he was a retired Army doc who came to Asheville and saw the inequities. And again, the caveat here is that he was really big on data. And so again, we're talking about census, so I'm bringing it home for us. And so he really thought about how health was impacted in an equitable fashion in Western North Carolina. He saw the disparities. And so comes the word Asheville Buncombe Institute of Parity Achievement. So thinking about equity before it became a buzzword.
Exactly.
That's really what he was talking about, right? And so it's amazing that he was thinking that, okay, there's a problem, but I'm just not going to sit on the problem. I'm going to develop a solution. And ABIPA was that solution where he knew that he would be able to garner his talents, his strengths, and his passion to make sure that community was taken care of around health in a holistic manner. Another thing that he really started early on was the idea of parity action team members. But what that really is in our world right now, in this decade, is community health workers. Back then, he was making sure that people were getting family members or friends to help them advocate in the hospital system if they need to go to the doctor's office or anything else like that. And so again, it's just one of those things that knowing that people are forerunners before they even think about it, just because they're doing the right thing. And
Visionary.
that's really why I love the work. Yes, visionaries, visionaries indeed. And so that's why I really love the work that we do here at ABIPA, because I know that it's an alignment. If anyone is ever in Western North Carolina, please come visit us. We just acquired a new building. And it really is, again, one of those things that was a dream of Dr. Blair, because he wanted to bring the model of the Jackson Medical Mall to Asheville, but he passed away before he was able to do it. And I remember being 10 years old. And again, we're talking about our life's mission, our purpose that sometimes we don't lean into, and we do consciously and unconsciously. I remember being about 10 years old and drawing a little diagram of a place where everything could take place in one space, where you can get your food, your clothes, kids were taken care of. That was before Walmart or Wally World existed. But that was a dream that I had as a kid. And so, again, we're coming back to BIPA's Life Center, which we just acquired last year, and we're in full mode of capital campaign. But it is a place where people can come and get the things that they need. And so I think that that is really one of the things that's really important in the time and space that we are now, that one, BIPOC organizations own their own, but we're able to do the heart of the work the way that we know it needs to be done in revolutionary and innovative ways. And so I think that's the reason that the conversation with NC Counts is so important, is because every voice matters, even if people don't know.
Definitely, definitely. Now that you already gave us kind of a diagram, how does it, became an organization? What exactly are the services that you provide in that area?
Oh my goodness.
Have we
You
start?
open up the floodgates. You open the floodgates. And so one of the things, the core of the work that we do is holistic health. So I like to say that physical health is the entering wedge, but then we tuckle on everything else. And a good way to even explain that is like walking through our building in your mind's eye. So the building that we live in, that we're in now, is called ABIPA's Life Center. And the reason that we've named it Life Center is because life has so many interactive points. And so when you go through the building, you enter in and you interact with mental health. We now have small steps of recovery that's there doing mental health screenings, education, counseling, and helping people on their road to recovery through addiction. And we know that mental health is a part of our holistic health. Then a part of another suite is our financial health. And so the financial health is where people can get counseling on one, budgeting, how to invest, how to purchase property, how to build their small businesses. So again, another part of their health, what your mental health and your mental health and your financial health. But then you go on through our suite and you go into the A suite, which is our ABIPA suite for your physical health. So for us specifically, our target is chronic disease self-management, making sure that people know how to advocate for themselves, and we come alongside them in their health journey. But knowing that health has all of these intersections is what's really important to us. So we have community engagement markets that we partner with the county and Manna Food Bank in food distribution. Formerly, before state funding got halted, we were doing the Healthy Opportunities Pilot, where we were delivering food to individuals and families in 3 counties. In Buncombe, Henderson, and Rutherford County, we're serving over 250 families, about 800 food boxes per month, which was not, to say the least, it was a big expedition, to say this, you know. But again, it's one of those things that we know that people need um, with their health, to be able to make sure the healthy option is the easy option. So we were able to deliver food to people that they actually got to choose. So I curated a list from where we shopped at Ingles, and people actually choose off of the shopping list the things they wanted. That way, you have that self efficacy, but you're also having things that you normally wouldn't purchase because you might have a tight budget. And so we were really, really proud of the program. And if anybody's watching before, right now, or going forward, we say still advocate for healthy opportunities across North Carolina, especially in Western North Carolina, because we just endured Hurricane Helene and we're still in long term recovery. So this is not the time to stop benefits, right? And so, look, that's my advocacy part. And again, we're going to go back to that. Really matters when it comes to NC counts, right? Because one, we need to know what the demographics are that we're serving. We need to know how many, what the households look like, and then what is the age demographic. All of that is really important to the work that we do, because we can't do it if we don't know who we're serving. We can't amp up our work if, again, we don't know who we're serving or how the population may be growing or diminishing. And so that's why I know it's really, really important. And so right now we're really in that vein of long-term recovery, making sure that our family members, our neighbors have the things that they need. And that's another service that we offer in ABIPA's Life Center. So yesterday we had our free Sunday shop. And so what is a free Sunday shop, you may ask? Of course, I'm going to tell you. And so people are able to come in and they can get free supplies. Like we had, I say, from lotion to lamps, we always had it. So they're able to come get cleaning supplies, household goods, like paper plates and things like that, in addition to food, fresh produce, and some of the staple things they need in their pantries. And the reason I know that's really important right now is people would say, oh, they're just coming to get free stuff. That's not the way we look at it. It's an investment in community. If they're able to come to us and get maybe $250 worth of supplies, that's $250 that they could put back into one, an emergency fund, taking care of another bill, getting medication, or just trying to figure out how I'm going to pay that next bill, right? And so that's really the way that we look at the work that we do, is how do we come alongside our community members in a way that we know the things they need, and then they also can tell us where the gaps are. A good example of that was at our free Sunday shops. One of the elders came and said, Jéwana, you know, you all have a captive audience here. We need to be doing some disaster preparedness training while people are waiting to go into the shop. And so I said, okay, good idea. Let's do it. So they actually came in, they started doing dehydration classes on how to prepare for storms, even though we've been through it. What's in your bucket? What do you need to have in a bucket for yourself if a disaster strikes again? So again, that's the reactiveness in real time that we're able to do, because we own our organization. We are the organization, and the community is a part of who we are. And so I think, again, from the work that we do in the holistic mindset, not just talking about it, but really being a vision and an example of equity in action, and the ecosystem of the funds that come in from partners like NC Works to help us along the way in our advocacy goals, and then from the other organizations and philanthropic thrusts that really believe in the work that we do. That's why we're here, and that's why we're really excited about the work.
Wow. Wow. I mean, speechless. And you mentioned something at the beginning, a holistic approach. That's exactly what you're doing. Now,
Yes.
if people move to the Western side or they are in already, do they need to have kind of a membership with you? It's something that they need to be registered in order to have all the benefits that you're offering?
Yes, yes and no,
Okay.
right? So everything is free because we're nonprofit. But the what we have started, which I think is very innovative too, we're utilizing a software called Oasis. So when people come into our facility, we used to use sign-in sheets, right? And we know a lot of times that's not really the best because people can see people's names and it's all of those things, right? HIPAA and whatever else. And so now we started using a QR code where people can sign in, put all their information in that includes their household size, the names, addresses, also their economic background per se. And so when they come in, they actually get a card that has the membership number on it, just like you would for your Advantage card. So when people come in, we're able to scan it, and that's the way we count them. But it also allows us to connect them to other services throughout the continuum of the things that ABIPA does. So if people are signed up and they've come to our Sunday shop regularly, they'll get a notification when the next Sunday shop is. And so they can share that. Then another way to build on the data that we brought in, we're able to say, okay, well, we know that we have said number of families with this number of children. So when we did our back to school, we knew that we may have needed like 1,000 backpacks. And we knew which age categories we need to fill according to the number of people that we have registered in our system. So there's not a fee, but there is a
Mm.
system because we know that it's really important for us to be in the system to be able to take care of ourselves. And so of course a lot of people are like apprehensive. I really don't want to sign up for one more thing. I don't trust QR codes. Is my information going to be secure? Yes, yes, and yes. Because we just have to be very more intentional for to make sure that we're effective in the work that we're doing. And so I think too that can help us with census data, right? Because if we're looking at the people that are coming in, we're able to just figure out which counties are coming to our facility, and then we can figure out what racial or ethnicities that people are coming in, which again is varied. And so being able to compare that to current census data, we can see where gaps are, or we can make some assumptions or figure out what we might need to be looking for.
Mhm.
And so I think that the Oasis is really a great tool for us to utilize with current census data, and then also encouraging people to let them know why it's really important to be involved in the census in the first place, because resources come in according to our numbers. And sometimes when we are in depletion, we don't understand that to be a part of the system and to work efficiently and to get the things we need, we have to be counted.
Talking about census, and now that you are explaining people, hey, the provisions or the things the yeah, the goodies that we need are coming based on the numbers, on the data that we are collecting through, the QR code. Do you think that people get the idea about that they trust, like, hey, we need to provide this because this is coming from the federal government, so on, so on? Or do you think people still need, like, I don't get it?
It's it's both and.
Mm,
Right? Because I think that when people are still apprehensive about sharing their information, period.
mm.
Because then because like I'm one of the ones, I can't stand a spam call. If I don't know the number calling, better believe I'm probably not going to answer. You better leave a message or text message me, right? And so it's that part. It's just being real with people to let them know. I think that some people get it, but then I also know that it's one of those things we have to repeat, repeat,
Mm.
repeat, repeat, and then repeat, and then also exhibit what it really means. So even in our repeating, giving people examples of how it works and letting them know. And that's why why staff and I talk to people when we're signing them up to let them know this is the reason we're collecting the information. This is what it looks like. Because even sometimes if we talk about surveys and things that we normally do in public health or whatever else that we do, a lot of times people collect the numbers, but the people from whom the numbers are being collected never see the results, even and not don't know it in the way that a lot of times we know because we work in the systems. They don't know that a bridge may have been made because we figured out that this much traffic goes across it.
Mm.
We don't realize that uh, 10 gallons of water came in because of the number of people that were here. And then saying, if I know the number of people that we're planning for, if you're not counted, you may not get what you need because we didn't bring enough resources in. So, a good example of that would be if people signed up and then we knew they were coming to the free Sunday shop, we could say, oh, okay, well, we're going to get 200 packs of meat for 100 people. So each person can get 2 packs of meat. But if we get 400 people and we only have 200 packs of meat, everybody is not going to get a pack of meat. But that's because we were not able to aptly plan because of the numbers.
It's interesting because you mentioned also that you tell the people we need to collect this data for this. So you not only are providing info to the people that is visiting your place, but your coworkers, and all of them can be ambassadors and and kind of break the barriers that we have towards the census. It's like, "Nah, I don't want to, but you are doing what we need to do in our daily basis, definitely.
And I also think that there's a bit of fear too. I didn't touch on that, and
Yeah.
I'm sure that's something that we've been talking about too. Is the fear of giving the information about who you are and where you live.
Hmm.
So we have to be real about that too in the time that we live, that it could be dangerous or it could evoke a spirit of fear within you that's real, and you feel it in your body.
Absolutely.
So I feel like it's also important for us to let people know that one, if give us your data, we're protecting your data. We're not sharing this with anyone else. The only reason we have it is so that we can serve you better.
Mm.
And I think that we exhibit that best in the way that one, we continue to interact with people. And the more that people come back, they realize that it is a safe space and that it is for everybody. Of course, we have target populations that we want to make sure we're taking care of for BIPOC organizations that many times are under resourced. But I even feel like for us, it doesn't even really matter about the resources that you have access to or not to. Because all of us, no matter who we are as a citizen, we all need something. Whether it is that we need good bridges, we need clean water, we need housing. So all of those things are central. We need safe
Mm.
neighborhoods, right? All of those things are central to us living a meaningful and a fulfilled life. And so I think the more that we continue to stand in that space, as we continue to advocate for people being counted and also being advocates and being involved and being civically engaged, all of those things are very important, especially in an age where we have a lot of misinformation.
And that is something that we need to do in every day, in every day, because yeah, we need to plant the seed and little by little, taking care of it, and people will say, okay, I trust you. I will complete the census. Definitely. Um, what has been for ABIPA, the alliance with NC Count? How the
Mhm.
alliance that we have has impacted your organization?
Yes, again, just giving us a better sense of the importance of one, the resources that we have locally, regionally, and across the state when it comes to advocacy around the census and the importance to it, and also even access to resources when Hurricane Helene hit, making sure that we're able to take care of our population. All of those things are really important, right? And so, whether it's the in kind support that we get from technical assistance, acknowledging where resources may be, things that we can plug into, or simply Angelica sometimes just showing up to support at an event. All of those things are really important and have been very valuable to us. And I feel like the more other organizations are aware, it may not, people may feel like, well, that's not really important. But some of the things that we can't afford to have the time to, we can't afford not to have the time for, right? So we can't afford not to make sure that we're all counted. We can't afford not to make sure that we're civically engaged, no matter what our viewpoint is. And I think that's what's really important is to continue to let people know that it is bipartisan, as a number. As a number, you're bipartisan because you have your own experience. And then you have similar experiences to other people. And so I think that's what NC Count has really come alongside us in our belief system and our core values as an organization, ensuring that we are here, we are acknowledged, but also making sure that the people that tend to be invisible to others are counted in a way that is very impactful and also respectful at the same time.
Wow, I love how you ended up. So I don't have anything more to add if you want to add something, but I love how you picture not only the alliance, but most important, us as community, as a people.
Mhm.
So I don't know if you want to add something else. For me, I love what we have
I,
talked today.
really, I don't have anything else other than just for people that are listening and thinking about the work that you do. Just, I always want us to level set that when we count numbers, each number that we have is actually an individual, and that ripple effect to their family members, their friends, the communities, the counties, the state, the country, the world is real. I had a friend that I remember when I was in college. She used to sit and say, "You know, Jéwana, I wonder where that car is going and what they're doing." And if we remember that in our work, remember that every decision that we make, every service we provide is actually making an impact on people just like us who just want to have a good life, want to take care of their families, want to enjoy traveling. That's what this is about. That's what the work is about. We really have to be counted, and our voice counts, and we all matter. So, thank you again for this opportunity.
No, thank you. It was a pleasure. And again, I think you say the most beautiful way to be counted, and how people matters, how the voice need to be here. And definitely, it was a pleasure talking with you today.
Well, thank you.
Thank you so much. Take good care.
Bye.
Bye.